Hello and welcome to NYFA's Webinar Wednesdays, a virtual series specifically designed for Nebraska communities and housing partners. My name is John Turner, Manager of Community Development and Research at the Nebraska Investment Finance Authority. Also joining me today from NYFA is Susan Poulos, Outreach and Community Development Administrator, who's behind the scenes helping to monitor the questions in chat. Before we get started, I'd like to take this time to thank our sponsor today. That's Midwest Housing Equity Group. So thank you for attending today's webinar on sheltering vulnerable populations during a pandemic. We would like attendees to save all questions until the end of the presentations. You can use the question feature to input your questions, and NYFA staff will hold those until the end of the presentations. If you would prefer to ask your question, simply raise your hand and we can unmute you. Our moderator today is Vi C, Executive Director of Community Action Partnership of Lancaster and Saunders counties. Vi has held this position since 2008. Community Action empowers people living in poverty to reach economic stability. Last year, its 17 poverty-fighting programs served nearly 18,000 people, focusing on meeting needs intensified by COVID. And since our discussion today is around how homeless shelters, addressed how to help folks during a pandemic, we thought it'd be important to have a couple poll questions for the audience, just so we can kind of gauge where you're at and see how you have handled situations. So Susan, if you don't mind launching the first poll for the audience. Okay, you should be seeing it up there. Do you currently have a mask mandate in effect in your organization? Just take a few seconds to answer that question. Looks like we're seeing a high percentage, 84% right now, yes, 16% no. All right, and so there's our results there. Thank you, Susan. Looks like 84% said yes. And let's go ahead and do the second poll question. And this one is, do you have an agency-wide mandatory mask or vaccination requirement for your on-site clients and guests? All right, this one's kind of moving back and forth, but I think now we're starting to see more yeses come in. All right, looks like a 70-30 split. So let's go ahead and share those results. And I guess I should ask, you can see those results, correct? Okay, very good. So looks like 71% said yes and 29% no. So thank you, everyone. We'll have a couple more poll questions before our Q&A. So without further ado, I'll kick it over to Vi so she can introduce our panelists. Thank you.
Thank you, John. I appreciate the opportunity to be in the front row for today's conversation. And of course, probably the best thing about Zoom is that we are all in the front row for our Zoom conversations. You've joined us this morning to hear from 3 Nebraskans who lead efforts in their communities, Omaha, Lincoln, and Grand Island, to support those who are and were homeless during this COVID-19 pandemic. As of yesterday afternoon, Nebraska's total confirmed cases of COVID were slightly over 220,000 cases. 32% of these cases were in Douglas County, 3.5% in Hall County, and 1.8% in Lancaster County. We know that total population and many other factors impact the rate per county. I can find no available data or projection for Nebraska that estimates the frequency within our population that is homeless and has contracted COVID. So I'm curious to see if our panelists have more information about that. As representatives of businesses, nonprofits, households, and personally, within our work and home groups, we have all faced very unique challenges in the last year. But I can think of few leaders who faced greater challenge than those leading Nebraska's services for those who are homeless. Today, we will hear from 3 of these leaders of nonprofit organizations. Each of them will spend 15 to 20 minutes describing their agency's mission and operations, describing how the pandemic impacted their delivery of services, how it impacted their employees and their volunteers, and how they adapted their work to serve very specific needs within their communities, but also support implementation of public health priorities to prevent illness and spread within the community. Later, you as guests will have an opportunity to ask questions via chat. We encourage you to enter those questions as soon as you have those, but we will prompt you again later, and our NIFA staffers will make sure that they facilitate getting answers to your questions. There will also be resources that are shared in the chat, so feel free to check there frequently. Today's panelists suggested that I keep their introductions very short to allow for more time for them to share. And I want you to know that other than what I'm sharing, their bios include impressive information relating to their academic and experiential history. Our first presenter is Amy Pappas. Amy is Vice President of Operations at People's City Mission in Lincoln. Amy joined the mission in 2020 as the volunteer coordinator. Today, she manages all facets of operations, including its programs, shelter, transitional housing, the help and recycling centers, and the health clinic, along with managing its kitchen, maintenance, and human service departments. Amy is very active within the Lincoln community, including service on Lincoln's Homeless Coalition, and in typical years, supporting the planning and holding of Lincoln's Homeless Connect event. Welcome, Amy.
Thank you, Vi. Good morning, everyone. People City Mission is here. We're Lincoln's only homeless shelter. Our primary mission is to shelter and feed individuals in the community that are facing homelessness. We do a lot of other supportive things along those lines as well, but that's our first and foremost focus, is taking care of the people in Lincoln that do not have anywhere to go, that want to come to the mission. While doing that, we also provide clothing, household items, furniture, food to people in the community that may not be homeless, or if they're homeless, aren't staying at the mission, but also frequent our homeless prevention center over on 68th and P Street. And our medical clinic is open and providing dental services. The pandemic was interesting for us as far as providing the services. One of the first things that happened when COVID-19 really took off was that we did close down our medical clinic for all services. Prior to COVID, we were providing dental, podiatry, chiropractic, and mental health services there. Once COVID started, we completely shut down and did not provide any services, which did create a huge need in the community, especially in the dental area. The Homeless Prevention Center did continue services to the people in need in the community, though we did started practicing a lot more social distancing, limiting the amount of people that could come in at one time to pick up items that they needed, and also making sure social distancing in the waiting room when people are waiting outside and during checkout procedures. Because if you've ever been to our distribution warehouse, it can get pretty crowded. We see a couple hundred people a day that go through there. So we really had to rethink how doing that, all along the lines of a lot of our volunteers that helped out at our prevention center disappeared. So we had to kind of get creative with staffing and making sure things could continue to run so we could continue to provide the needed services in the community, but safely, and keeping the staff and the individuals coming in safe. The shelter was a lot more interesting as far as how we were going to go about keeping people safe when staying at the shelter, including staff, the limited number of volunteers we had coming in, and of course the sheltered guests. We have been very fortunate here at People City Mission to be working hand in hand with the health department. As soon as COVID-19 took off in Lincoln, the health department stepped up and come and talked to Pastor Tom and myself about what can they do to help prevent a huge outbreak of COVID among the homeless population in Lincoln. And a lot of good discussion had come about from that. One of the wonderful things that came about from that is having some funding provided from the city that allowed the health department and the mission to move 15 families that had been staying in the mission's family shelter into a motel, into their own rooms, to give them more opportunity to have their own bathroom space, their own living room space, their own kitchen area, so that they could kind of keep themselves and their families safe without being in a communal living situation. The family and women's shelter, when you stay over here, the families do have their own rooms. However, bathrooms, living space, dining space is all very communal, so that you don't have your own personal space other than just your room to go into. So by moving the 15 families there, and we did that at the beginning of April, it gave them a little bit more flexibility. We did have 4 families that were left here that were not interested in moving to the motel since they were on the verge of getting moved out. And so what we did is we kind of spread them out around our family area so that they had more separation, so that they had a little bit more privacy and can kind of help prevent the spread of the COVID-19. As far as our men's shelter goes, that was probably our biggest challenge, is what do you do when you have a bunkhouse that houses 101 guys? And so working with the city, we found a couple locations and started an overnight only shelter, which half of the men from our men's shelter went to the overnight shelter, where they could have a place they could spread out more, sleep, have meals over there. We did that for about 3 months, and then went back to, things kind of had settled down. So we kind of merged everybody back here. It was into summer. So we had about 70 people over here again, instead of the 101 to 120 we sometimes do. And then that second round of high COVID numbers started spiking in the fall. So we worked with the health department again to find a second location to separate about half of the guys. So about 40 guys went to a separate location to, again, kind of help prevent the spread of COVID in the bunkhouse, because it is hard to social distance when you have 101 people in one room and they're sharing a large communal bathroom. We also worked with the health department during the summer when initially to set up a COVID quarantine unit for individuals that were homeless in the community that needed a place to come to COVID, whether they were waiting the results of a COVID test or if they had tested positive for COVID and didn't have anywhere that they could recover or stay. And we did that for a few weeks. We honestly, when it was going on, COVID was still kind of new. And so we didn't have very many takers. So what we did is we kind of looked how we could house anybody already staying at the mission in a quarantine unit, and did set up a couple different areas for families and women that could quarantine, and then for our men's shelter guests that could quarantine if they needed to. And then over the course of the time, we have had about 15 people that have tested positive for COVID that stayed here. We've been very diligent with, as soon as someone mentioned having symptoms, needed to test. Once in a while, we didn't even know that they tested until they came back and said, oh, by the way, we're positive for COVID. We were able to move them into an area where they had their own bathroom. They had their own kind of lounge area. Staff took meals up to them, made sure that they had everything that they needed, made sure if somebody needed help getting to a COVID test to be tested, we could get them to a testing site. Things like that. And so we were really able to kind of isolate people so that they didn't have to wonder where they were going to go if they were homeless and had COVID, but also could help them keep them feeling safe and protected during that time. We started wearing a mask mandate before the city actually did. So if you work here or living here, volunteering here, masks were absolutely mandatory, and we're continuing that right now. I talked to Pastor Tom yesterday briefly about, how going forward what the mask mandate would look like. And he said he were going to continue to wear the masks until at least the end of June and kind of see where numbers are at and different things like that before he would consider relaxing the mask mandate. We've set up we've had a COVID vaccination clinic out here where we vaccinated 53 homeless individuals, and we're getting ready to do the second clinic next Monday. So we're excited about that, giving people an opportunity that are homeless, that might not be as easy to get somewhere and get registered to get a COVID vaccination, can do that. And we're just kind of continuing on. We upped our sanitation so that we're sanitizing everything twice a day. Incorporating to get more buy-in. We have guests that are helping us do that. For some extra credit, they can come and help sanitize. For a while, we were in lockdown where people could not go on overnights if they were staying here to kind of help curb. But as the numbers in Lincoln have gone down, we've kind of relaxed some of our our requirements, though we still do require new people coming in to have a negative COVID test. We take temperatures 3 times a day, and we're still really diligent on mask wearing. And that's kind of what we're doing to keep people in the Lincoln community, the homeless community, safe from COVID. But like I said before, we're extremely blessed to have the support of the health department.
Thank you, Amy. I have to say that Community Action's primary location is 2 blocks from the People City Mission, and I think numerous times every day I'm reminded of the significance of the work and the quality of work that you all do. So thank you very much for that.
Thank you.
Our next presenter is Candace Gregory. Candace is President, CEO of Open Door Mission in Omaha. Since joining the mission as a case manager in 1995, Candace has also served as Director of Family Ministries, Director of Lydia House and Family Ministries, and Chief Operating Officer. Candace has become a noted national advocate for the homeless and is sought out for her experience in implementing community prevention programs that help end the cycle of homelessness and poverty. Welcome, Candace.
Thank you, Vi, and good morning. I'm so excited to share with you the Open Door Mission's response to the pandemic that we have been battling. And I'm hoping that you can see my screen. Is that true, Vi, that you can see everything?
We can. Looks perfect.
Okay, great. Open Door Mission meets the basic needs of individuals and families while inspiring hope for lasting change that Vi mentioned very clearly. Is our goal is to break the cycle of homelessness and poverty. And we actually have 917 safe shelter beds here on our campus. So not everyone says, come on over and stay the night, especially during a pandemic. We truly believe that at the Open Door Mission, hope begins with a meal. And we, during the pandemic, continue to serve meals. We provide over 4,700 nutritious meals on a daily basis. We have homeless prevention programs. In fact, one of our largest programs is our outreach centers, where individuals and families can come once every 30 days to supplement their income. And that's through our Manna Food Pantry, where it's consumer choice and they get to choose their items for their pantry, a package of diapers, a toiletry kit, and of course, anything that you find in a thrift store that's gently used, they can take with them to supplement their income. We actually have 40 programs that we offer for free to the community at large. And when COVID hit our community, our team had to pivot very quickly, and we had to plan, get ready. And today in 2021, we can say that we are planned and we are ready for any pandemic that may come our way. We have learned more than we ever thought we would. And I'm sure that many of you can say that. We are very much in tune with our community, and we could not say enough about their support. In fact, we are blessed with the UNMC's infectious disease team that came into our facility, toured, gave recommendations on 3 and 4 different occasions during this pandemic, as well as our Douglas County Health Department, that you'll hear the wonderful partnership that has protected those that are marginalized and most vulnerable during a pandemic. One of the very first policy and procedures that we implemented was providing our CDC questions and our intake outside of our doors, meaning that we actually did our intake questionnaire on our stoop, for lack of a better word, our steps. We also did a forehead temperature, and we also implemented temperature and symptom checks twice daily. We actually now have thermal temperature readers on our campus, and we actually moved from the forehead to the thermal, which we believe is much more accurate and more dignified, where someone actually just places their wrist to the thermal temperature reader, and it actually has a large, loud noise if it is not within a normal temperature range. We actually moved very quickly to isolation. We started at 10 days for any of our new intakes, then 7 days, and now currently If you are a person that's experiencing homelessness entering our emergency housing, you would be offered either 3 days of isolation so that we can monitor your symptoms and temperature, and of course educate you on the importance of mask wearing properly, hand washing, cough etiquette, good hygiene, and social distancing. But we also would offer you rapid testing. This is actually a picture of Steve Frazee, who is our senior program officer, and he and some of our team have been trained to provide rapid testing in our clinic, and it has eliminated the painful isolation for many of our guests who struggle with mental health. And for others, that eliminates the chance, of course, if they're negative, of not missing a day of work in isolation. So we're super grateful. These rapid testing have come through a partnership with our Douglas County Health Department, as well as Department of Health and Human Services. Right away, we moved our guests who were medically fragile into I slipped a picture here. We moved our guests into that were medically fragile into a local hotel, thanks to the partnership of Douglas County Health Department. And we used the CDC guidelines for medically fragile, and actually started that in March of last year. And just about 2 weeks ago, moved our last medically fragile guest into a higher level of care. And I'm very excited to share with you that 100% of our medically fragile that were in the shelter communal living that moved into the medically fragile hotel through our housing navigation, our staff providing clinics and medical services, as well as case management and symptom and temperature checks daily, as well as their meals, have moved all of those guests into a higher level of care with assisted living or independent, stable living environments. This is Terry Kraus, and I'm mentioning some of my team to you because we could not have done what we have done here at the Open Door Mission if it was not for the current leaders and those that rose up within our team to help us develop the right and safe protocols and procedures. And this is entering our isolation area, and you'll notice they're in full PPE, and that is because they are going to serve in our hot wing, which we call it. Our hot wing has positive COVID patients, and you'll notice have poly walls will travel. And this is poly wall with a zipper. You'll notice that there's an entrance and then an area where you take your items off and come out of, and all of that training was done. We have now infirmary rooms, quarantine rooms, isolation rooms. We have a color card system on the doors, red, yellow, and blue. And that's for communication purposes. One of the other things that we implemented here, because I have a bunkhouse with 180 beds for men experiencing homelessness and emergency situations, we actually, at the beginning, you'll see in the bottom, the duct tape, the wonderful duct tape and some of our tents that we improvised with. But actually, our men embrace these tents. They feel safe. They can actually zipper those down, and they can not have the anxiety of possibly droplets falling on them or dropping on them from somewhere else, and created that safe atmosphere for them. These are our hand washing stations. We have these at all of our entries now. If you enter the Open Door Mission, we not only will ask you to take your temperature, but to wash your hands, or you can actually use our hand sanitizer that we have on our rooms, but most on our doors and wall, I'm sorry, not doors, but on our walls, the hand sanitation. We actually have found most people are very appreciative of having the opportunity to wash their hands. So things that we take for granted. We have a full educational program where we are posting everywhere, and we are having in our house meetings, in our bathrooms, anywhere you can imagine, the proper hand washing and cough etiquette, how to wear masks properly. In fact, that's something that we're going over on a regular basis. And we are so grateful. We here at the Open Door Mission had thousands of fabric masks donated and made available to us so that we were able to encourage, and we do on our campus, despite Omaha having a mask mandate, we had a mask mandate prior to that to keep everyone safe. And it is truly an educational process, educating everyone how to wear those masks properly. We had PPE training for everyone that was, and we actually now have a site where our employees can go and brush up on all of the policies and procedures and how to wear masks and PPE and gloves and don and take them off, on and off properly, and those type of things that we're going through on a regular basis. You know, we have scrubs for all of our staff, and we actually, this is one of our things that we thought was welcomed by our team, because we had to actually shelter in place for actually on 2 different occasions due to an outbreak. The National Guard came in and helped us with all of the COVID testing. And we actually 80% of my administration staff for about 9 months spent 30 to 40 hours on the front lines, as we did not have volunteers here at the Open Door Mission. And if you ever have gone through this experience where your administration staff are a support to your front line, many of our administration staff had never had human service training. And so we are basically there as a support to them, and in our kitchen, our hospitality department. And one of the positives from COVID, that created unity and team bonding across our team that exists even today. We actually, when we did medically fragile, yes, we actually started using containers to go, because when we were shelter in place, we literally did not have visitors, volunteers, anyone coming onto our campus. And we literally had to pass out meals at our door to those that were used to coming to have a meal on our campus. We literally going through that shelter in place with no volunteers, no community service, no community partners coming on property, allowed us to really address all of our policy and procedures when it came to cleaning and sanitizing surfaces. And we still today are cleaning every 3 hours during waking hours, all those high traffic areas. And one of the things that helps us be efficient is these foggers. And we have foggers to disinfect in all of those high traffic areas, and we use them on a regular basis. We actually had the lovely experience of having our children that were enrolled in Omaha Public School home for over a year. And so we really quickly, when we were shelter in place and over 128 school-age children not going to school, had to implement SuccessNet. And in SuccessNet, we had to hire not only teachers and paraprofessionals, but again, our administration staff joined that team and assisted with offering 5 days a week academic assistance, as well as parent relief for our parents who their daycare's closed. And for many of them, that 50% are experiencing domestic violence, they had no support for their families. And so we are so blessed that our staff stepped up. In fact, this is my housing admissions director and my IT help desk providing parent relief for our children that were infants and toddlers 5 days a week at the Lydia House. We have now enrolled our Open Door Mission Volunteer Return to Work rollout. We are in phase 4, and we are excited that we have approximately 2,000 volunteers that have returned to us on a monthly basis, volunteering about 2 hours. We are so excited to hopefully be in phase 6 by September, and that will hopefully embrace more volunteers. But we did have to get creative. We created a VIP, be a VIP. You can volunteer in place. And we have been very successful in having hundreds of businesses and individuals actually join us in Volunteer in Place. In fact, for our Summer of Hope campaign, we're calling on people to plant a row. We'll provide the seeds. Would you plant a row of fresh fruit and vegetables to feed the hungry? And we've had a wonderful response to that. So we've had to get creative to continue our mission here at the Open Door Mission. We had to close our drop-off locations, as I mentioned, with our shelter in place and our outreach centers. And when we reopened after 3.5 months, We literally had to change our sorting process, as we don't touch anything for 24 hours until we reopened with dividers and intakes for the intake tables. We used a lot of tables to create 6 feet distance, as you can see in this picture, that the consumers on the other side of the table with their grocery cart. These are the dividers between our volunteer intake staff. We actually had to change all of our in and out ways to create that social distancing when you serve 10,000 families every 30 days. And we actually partnered with Farmers of America. And we are so grateful. We were able to serve more than 2,000 families a week, offering them fresh fruit and vegetables. We are so grateful that we have transportation here at the Open Door Mission, that we were able to use Polly to create a safe way to transport our patients that were having symptoms that created complications to transport them to hospital. And so this is how we actually did that many times throughout these last few months. Implementing social distancing is extremely hard when you have the volume of people that we serve here at the Open Door Mission, but this is our attempt. We have spaced out all the tables in our community dining room. We only allow 4 to sit at a table. We have moved in our hospitality department to individual condiment sizes, so there's nobody passing bottles or dipping their hands into things. We literally have moved to paper products throughout the pandemic, disposables as much as possible. And this week, we just went back to dishwasher safe silverware and plates for a more welcoming and family feeling. And we have done that because we believe we can do it safely at this time. We actually had all of our ventilation cleaned by a professional company, and we have added the bipolar ionization to all of our HVAC units to keep that safety in our air circulating. We've had a safety kit that we use now on a weekly basis to go around touching our high traffic areas and hopefully knowing that the level, as you can see, the RLU levels are keeping within the area, and that just helps us to have a check and balance when it comes to our cleaning and our disinfecting. We have moved now into emergency rental assistance through a partnership with our Continuum of Care, metro area Continuum of Care for the Homeless. And through that, we've supplied rental assistance for over 550 families, diverting them from experiencing homelessness. And that has contributed to lower numbers in our Lydia House and our Men's Center, as well as through our City of Omaha opening 2 city shelters at local hotels to divert people from the shelters. We have just moved into a Lydia House Cafe. And some of the things I'm going to share with you as I wrap up are some positives that came out of COVID. We literally now serve our meals 3 times a day at our Lydia House for our women and children, and they no longer come to our community kitchen. They have their own volunteers that are serving them there in a safe manner. We actually, through the pandemic, learned very quickly when you shelter in place for 90 days, hundreds of people, you need more resource case managers. We've hired more nurses. We hired, as I mentioned, teachers and paraprofessionals, and we brought in more therapists. And one of the things that we've implemented is a wonderful program with animal therapy. And we will continue this program for our adults and children every week through the coming months, as we've seen such success with this program. We also learned that we can provide a really good program for children. And so for the 2nd year in a row, we will have our Kids to Camp program on our property for our children experiencing homelessness. One of the other things, who expands programs during a pandemic? This is our fabulous art studio. We took space and renovated, and we hired an art therapist. And we again are seeing so much success with art therapy with our men, women, and children that are not only experiencing homelessness during a pandemic, but are experiencing trauma. We've been blessed with our medical community. They're the one volunteers that continued throughout the pandemic, offering not only our vaccinations, but our flu shots. And we actually this evening will offer our fourth vaccination clinic here on our campus. And I'm very grateful that we now have proper pandemic protocols and procedures for our campus to follow in the future and today. I just want to thank you for the opportunity to share how the Open Door mission served and is serving and sheltering vulnerable populations during this pandemic. And I'm very grateful for the partners and the support from our community.
Thank you, Candace. This was a great opportunity for me to not only learn more about your agency and its programs, but I've learned so much relating to the resources that you implemented, and especially want to know more about the thermal temp reader. I love that idea. So thank you very much. Our third speaker today is Liz Mayfield. Liz is the Executive Director of Hope Harbor Shelter in Grand Island. Liz joined Hope Harbor in 2014 and moved to the role of Executive Director in December of 2016. She is an active member on the steering committee for Project Homeless Connect and the past chair of the local Continuum of Care. Liz also currently serves on Nebraska's Foster Care Review Board. Welcome, Liz.
Thanks for having me. I'm really appreciative of the opportunity to share what has been going on in Grand Island. I'm going to share my screen here. Hopefully it goes through. All right. Hopefully everyone can see my screen.
We are not yet seeing your PowerPoint.
Oh, okay. Hold on one second.
There it is. Thank you.
There it is. Okay, wonderful. Good. All right. Well, again, thank you so much for allowing me to come and share a little bit about what experiencing homelessness in Central Nebraska looks like during COVID. It has, of course, been, as has been expressed by the other panelists, a challenge and an opportunity as well. And so we're really thankful for the lessons that we learned and the ability to share a little bit about that today.
Come back. Okay.
So a little bit about our program. We are located in Grand Island, Nebraska, and we have kind of three main areas that we focus on. First of all, is our shelter programming, where we provide emergency and transitional shelters for single women, single parents, two-parent families, and married couples. The only population we don't serve is single men, because they do have sheltering other places in Grand Island. We also have community assistance programs offering basic needs to anyone, including food, gas, ID vouchers, diapers, hygiene items, etc. And then finally, I'll talk a little bit today about our response to the pandemic, in which we absolutely felt the need to begin a housing program, similarly to what Candace just shared as well. So we'll talk a little bit about that today. So for us, COVID-19 was, an interesting, and still it continues to be an interesting challenge. Of course, when you're working with populations that are used to being in congregate areas, we absolutely, obviously had to work through a lot of that. And pretty quickly, Grand Island and Hall County was hit really hard and was considered a hotspot. And in fact, for parts of Q2 of 2020, we were a hotspot in the nation. And so we, due to kind of the nature of our environment, we have a lot of food processing plants and other essential businesses that were in operation throughout this entire time. And so our community certainly felt the impact most heavily in Q2. And so as we kind of navigated through the crisis, one of the challenges, I think, for any agency or organization that we felt is just all the different areas that need to be addressed. And so kind of wanting to touch on a little bit of those today. First and foremost, of course, is safety, just immediate ongoing needs, figuring out how to live in the congregate area and really take care of not just physical but emotional needs. Staffing is a consideration. I know that's been mentioned as well by other prisoners, making sure that staff is safe, that we have sufficient staffing to meet the ongoing needs, that they are staying healthy, and especially as they fill in some of the gaps from volunteers that were not able to be on site. Supplies, of course, is always a challenge and will continue to be, but navigating our supply shortages and grant funding opportunities and looking looking for partnerships was a huge part of what has made us successful as we enter this or finish out some of this pandemic stress. Funding opportunities, I think, was also an interesting challenge that there were often new funding opportunities that were great, have been great opportunities to expand what we were doing. But then it also provides challenges as well, making sure that we can navigate through all those new relationships and all those funding requirements as well. Mission wise, it's always a challenge for any organization to stay on mission. So we were constantly evaluating, and we are always evaluating what we can do to make sure that the needs are being met in our community. And that's what led us to expanding into some of the housing programming that we did do. And then of course, the future, what does this mean? What changes can we take with us into the future? So as we think about safety, number one for us was really working with capacity. So understanding that we needed pretty much immediately to reduce our shelter population. We have 102 beds between our two programs. So we are significantly smaller than my co-presenters here, but for Central Nebraska, we are a key organization for families experiencing homelessness. And so right away, we needed to figure out exactly how we could take our capacity down to have it be safer, have the correct number of restrooms. And we partnered with our local health department, as well as through partnerships at our continuum of care to really discuss what that might look like. And so we were able to implement some policies right away to take our capacity down to about 50%. And part of how we did that was partnerships through hotel vouchers and kind of being a little bit creative of how we house people and individuals. And then from the other piece of it, from a safety perspective, is really navigating policy changes. And I think most people can kind of understand what this might look like. It should be on this slide. Here we go. So talking about safety, I guess, really quick, for bed nights, for us, as you can see, in 2019, we were near our capacity pretty regularly. Almost every night we were at or near capacity. And so for us in 2020 to take that down lower after we'd been steadily increasing was really a challenge. And so coming back down to a lower capacity was an interesting challenge that we tried to rise to. So going back to safety, as I was mentioning, first of all, of course, compliance with local DHMs. As was mentioned from other agencies, one of our first decision processes throughout this time was to really decide what our own individual safety protocols were going to be, regardless of what the DHMs were. So although the DHMs and the directed health measures were important and of course were followed in our shelter, we understood the responsibility to be a little bit more proactive than other entities because of the congregate living environment and because we were an essential part of our community and needed to continue to offer services. So we needed a healthy staff, a healthy environment, and of course to continue to keep our individuals healthy. So we implemented mask policies, social distancing policies, limiting and eliminating, overnights, outside guests, all those things really quickly in March of 2020, because we knew that we needed to be more proactive than most in the situation. Additionally, following CDC guidelines were of course a major part of it. We implemented the questionnaire and screening processes. We worked with our health department to set up ongoing testing. So we take individuals twice a week to be tested upon entry to our emergency shelter. And then we also worked with the health department locally to create some policies on testing, isolation, and quarantine, really trying to understand how we could best serve people, keep them safe and housed, but then also addressing some of the concerns of spread. In our facility, this was a little bit easier than most because we don't have any living areas that were like say bunk bed style. Every individual family would have their own room. Our bigger issue was finding a way to navigate through shared restrooms or communal restrooms, as well as communal dining areas. And so, as has been mentioned by the prior panelists, that distancing is challenging in those times, especially when you have a limited time to be able to really address those needs. So. Additionally, we had staff attendance concerns, not necessarily because my staff, of course, were amazing and they continue to be, but we want to keep them healthy. And so as they were exposed on the job or exposed outside in the community, we were continually assessing their attendance and making sure that we had coverage, knowing that our doors needed to be open for everyone in need. We also had to quickly decide that case management classes and other essential pieces to our programming had to be virtual, and that was the safest option. So we made some quick pivots in that area. I already mentioned the visitor and volunteer policies, but as Candace mentioned, I believe that, that severely and very distinctly impacts what our staff spends their time doing when our volunteers are not on campus and not allowed to be on site. And then finally, technology was a huge piece of it, which I'll talk about in a little bit. But it's been a huge part of understanding how to better serve clients that we'll definitely take with us into the future. So talking a little bit about staffing, our staff has done an amazing job continuing to meet the ongoing need, and then also becoming essentially step-in nurses. I don't know that that's the term for it. Maybe as CNAs or something, but they, for the first time for many of them, donned personal protective equipment, masks and shields, wore, medical attire, brought meals to individuals in quarantine or isolation, and they really just rose to the occasion. And I think most of us would say, I would imagine that our staff is really the reason why we have had so much success with moving through the pandemic. Additionally, technology, again, as I mentioned, has been a huge thing. In addition to just being able to still connect with clients, we found that many of the services in our area that were essential for our clients had moved onto online platforms, Zoom meetings, a lot of mental health. All of our contractors for mental health and medical appointments had moved to Zoom meetings or virtual meetings. Even our AA and NA had moved into virtual spaces. And so almost immediately we knew that we had a struggle. And as most nonprofits will probably attest to, infrastructure, operational infrastructure is a challenge to stay on top of because it's costly. And so one of the advantages was the ability to write some grants specifically for technology. And when we had students on site with their families doing virtual school, needing to access Wi-Fi for their Zooms, needed to have space and time and laptops, that was one of our very first and immediate needs, aside from medical equipment. We obviously were thankful to be able to work on this. I do think it's an ongoing need as some of our services will continue to be virtual. Again, as we learn from this adventure, we are understanding that there's some things that just work better and are quicker. We've had some great success with telehealth for quick questions that individuals have. And so I think we're going to continue to make sure that we have those opportunities available to our clients. Supplies as an ongoing need as well. So supply shortages have always been a challenge. And so for us, we had to create partnerships almost immediately to share supplies. We were able to really kind of understand that one of the main things that we saw in our area was, and we didn't understand the impact, I think, until a little bit, it was a lesson learned for us a little bit later than we wished, is how quickly, when there were supply shortages in our community for food, how quickly that impacted us. And so a lot of individuals or businesses who might have donated canned goods to our food pantry or food for our programming and our shelter residents, they were no longer even able to either access their own food resources or navigate that supply. And so for us, we had problems for several weeks just getting the basic necessities of, just like everyone else, meat, milk, toilet paper, basic supplies. Just as families were experiencing that, we were as well. But what we saw in the meantime is a huge increase, as you can see over the years, in people requesting assistance. And so in 2020, the people in need of community assistance, so just food pantry access, diapers, hygiene items, has skyrocketed in a lot of ways. And in 2021, we're continuing on that trajectory. And so for us, it became a really creative game of trying to figure out how we could find resources for things that everybody needed at the same time. A lot of phone calls, a lot of negotiation and partnerships were sought out during this time just to make sure that we had what we need to keep people fed and safe on our property. From a medical standpoint, though, I will state that our health department was huge for medical supplies. We were able to get those very easily. But for us, supplies that every family needed, we struggled with as well. So funding is a piece of it as well. And I, just want to touch on this briefly because this has been one of the most interesting changes. Obviously, we had to create a lot of new funding relationships very quickly because we had urgent needs. So obviously we initiated some partnerships with local funding, PPP loans, things like that. And then DHHS's response and recovery grants has been extremely helpful. In addition to just supplies, staff time, et cetera, we were able to then launch into our rent and utility assistance programming, which we found to be a huge piece of our puzzle. We needed to keep our shelter population, and we continue to need to keep our shelter population reduced. And so housing and keeping people stably housed has become a huge priority for us. So speaking of that, two different things have really been a little bit of challenges we've expanded and learning opportunities. So number one, we had not prior to COVID used housing or housing voucher, hotel vouchers before, because we'd always been able to meet the demand within our shelter or through our partners in the community. However, nearly immediately we understood the need to be able to house people who were COVID positive offsite, or people that were medically fragile or could not stay in a communal environment. And so we were thankful to be able to bridge those partnerships and be able to do hotel vouchers for those who were not a fit for communal living. And that was a huge key to decongregating our shelter and keeping our population lower. And then balancing staff has been the other need. And so we're still kind of in the midst of this. I mean, I think that understanding that, as Candace mentioned, like adding staff is huge, a huge part of what's needed. My light in my office keeps going off, guys. I'm sorry. But we're always balancing and trying to figure out how to connect with our internal shelter clients and our needs, but balancing our new program and making sure that those who are going to stay housed through our new housing assistance program have wraparound services and the access to case management that they need. We did add a housing coordinator in 2021, which is a huge step for us to be able to meet some of the external needs to keep people out of the homeless system to begin with. So as I wrap up really quick, one of the, as we're kind of looking to the future, I know my co-panelists really mentioned some opportunities of learning that we had. And I think this is where we really are focusing on now in 2021 and really deciding how we can make decisions that are future focused and building sustainable change. I think there's a little bit of a fear of, there's a lot of funding availability right now. And I know I have talked to and I experience just the need to continue to offer some of these services into the future. And so number one, just evaluating funding opportunities, making sure that they align with our mission, making sure that they are what we need right now. Not everything should be a yes, of course. And so making sure that we are aligning well with what we have and what our clients need most. For us, the second thing that has been really an important focus is to creating a culture of caring for our staff. Burnout and compassion fatigue, vicarious trauma has been huge. Our staff have been on the front lines. They provided client care that they really, frankly, haven't been trained for. When you're dealing with someone COVID positive or has an infectious disease, they have just jumped up and stepped right in. We've had staff members from all departments, doing things way outside their job description and helping out. But we are always keeping an eye on them because we know that our staff is key to providing good quality care. And so making sure that our staff continue to have support. I know one of the things we did in 2020 and have continued in 2021 is expanding the number of EAP sessions for our staff members to be able to access therapy regularly if they need to, and really encouraging them to do that on the clock as well. Number three, we want to keep the changes that worked, kind of as has been mentioned. I know that in a pinch, we had to make some changes. Some of them were excellent and some of them were maybe ones I might make a little different decision on. But we know that there's been some really good things that have come out of that. And so we have, regularly on our meetings now, our staff meetings, we're always evaluating what has worked, what needs improvement, and how we can better serve what we need to kind of keep in the future. And then finally, really just shifting that focus from immediate to long term. I think most of us can attest, no matter where you're at and where you work, how quickly everyone had to shift gears during 2020. And the phrase "drinking from a fire hose" is how it felt, right? So we're always kind of overwhelmed and trying to play catch up a little bit in 2020. But we understand that these opportunities really give us a chance to learn and carry those into 2021. So our challenge now is to focus again from those immediate fires that are presenting themselves to a longer term focus about how we can keep some of this change and the positives that we've seen come out of this. So that's my presentation, and I appreciate your guys' time.
Thank you very much, Liz. I noticed that you began immediately by not only acknowledging the challenge of the last year, but also the opportunity to learn and grow. And I appreciated that reminder. I also loved your recognition relating to the temptation for mission drift during the last year. And the fact that you wrapped up noting that some of those new programs and services that you were able to implement will likely stay within your cadre of services. So congratulations to you. And thank
Thank
you
you.
to all three of our panelists. I think that we all very much recognize the great energy, the resilience, and the personal commitment that you bring to your work. So from your presentations, we're going to invite you to all share your videos, and we're going to begin with questions. For those joining us as guests today, I know some of you are adding your questions to the chat, and we invite you to add those. I'm going to begin with a question, and you all very much acknowledged the commitment and work of the employees within your nonprofit organization. And I want you to think about and perhaps share with us, as you think back 12 months ago in May of last year, as the businesses around you, as some of the nonprofits around you were sending employees home to work, as some nonprofits were shifting to virtual models, what kinds of things did you implement to support and encourage your employees? And I think we can just begin as, whoever would like to jump in and begin with that, and we'll let the other two join if you like.
Well, when you are offering emergency services and supportive services to a vulnerable population 24/7, we don't have the opportunity or the options so much to do work from home. In many cases, as I mentioned, 80% of my administration staff for almost 10 months were on the front line supporting our frontline staff. And we did have to be flexible. We had some staff, due to their own medical issues and even their own within their family dynamics, and then others because of age. We had to be flexible and be creative. And some of our staff, we did make exceptions for working at home due to safety. Other things that we started to make sure was we literally started, even though you have all of the burnout and the issues of implementing all these new protocols and procedures, we actually really worked on those mental health days, those personal days, getting our HR department involved in making sure that we were keeping our symptom checks in place and things like that. But also, we were fortunate enough here at the Open Door Mission to be able to offer compassion to our staff just as much as we were offering to our guests that we were serving. And I think that for many times when you're giving, we forget that our staff are our number one asset, and they need compassion too, to deal with all of the struggles and challenges that are going on in our world today.
Thank you, Candace. Amy, Liz, would you like to add?
I will echo what Candace had said about providing the support and compassion for staff. And that's what we really tried to do here at the mission, because we didn't have a lot of extra staff. And so our frontline workers were here, had to be here. A few of our administrative workers were able to work from home a little bit, because we do have a handful that do have some compromised immune systems and needed to be away from the population in case of a COVID outbreak here, which fortunately we did not get. But encouraging the using of the time off for mental health, for just to go fishing. We had a couple people that would take a day off here and there just to go fishing, just to kind of to clear their minds, because we didn't have a lot of opportunity to switch out staff or in even some of the areas, some of the administrative staff, like Candace had mentioned, we're doing other things too here. We shipped in the kitchen because a lot of our volunteers weren't coming in. We have a wide base of retired volunteers, and a lot of them didn't want to come in, and we totally respected that. Helping out at our help center with food distribution, since a lot of volunteers didn't come out there. So we did a lot of cross training quite quickly, but then also on the same side, encouraging people, even though maybe you can't go on vacation somewhere, to still use your time off and just take some time away from here so that you can rest and recoup. We were very fortunate. Our HR department stayed up on the different COVID protocols and things, so that if someone, needed to be home with a family member that was quarantining or had COVID, or if a staff person did get COVID, making sure we had everything in place to support the person as much as they needed to be supported.
Similarly to my colleagues, those are all important things. I think, Amy, what you just said is so spot on, because it was very tempting in 2020 not to take any time off because you couldn't go anywhere. So if everyone said, what am I going to do? Sit at home? What is that about? So really encouraging staff to do that was huge. We also kind of tried to find some tangible ways to encourage staff. So we were able to start doing hazard pay, which was a huge thing for our staff. It was very encouraging to them to be able to kind of say, hey, our family's also going through some struggles, just like anyone else, some challenges. And so I think that was one tangible way. And then we did some care packages as well throughout the year. We were able to send the individuals who were able to work from home, we were able to send them some, little things to keep them going. And then same with staff on site, we did some t-shirts and did, kind of little things to kind of keep their spirits up. And then I think the other thing that we did that was really helpful is, at the time, we needed to get a lot of communication out really quickly and have a lot of really good discussion. And so we utilized technology to do that. We started some chat groups that were meant to be kind of a stress reliever. So in other words, if I want to share a little funny GIF or tell a story of something fun that happened with my kid, it was that water cooler moment that people were missing. So we didn't have any of that anymore because we were scattered and busy and stretched thin. And so offering, employees an opportunity to kind of find ways to have those connections still was huge. And so we were able to use some online message boards and things like that to kind of keep the spirits up. And then I think that made our transition back into, in person, as we started to slowly move back to that, quite a bit easier. And it also allowed people who were off site to continue to be cheerleaders for those who were still on site as well.
Thank you. I have one last question, and then we will turn it over to John to ask questions from our chat. You all mentioned the opportunity during the last year to benefit from both governmental and foundation support relating to COVID operations. What are some of the other kinds of support that you received from those volunteers who typically might be on site, or from donors who were less likely to interact directly with you, but probably felt what you were going through as an organization? I'm wondering if each of you would be willing to share an unusual or likely new to the year way that you received support.
I think the technology has really opened the door for some ways to communicate that I think all of us would agree that we're going to continue. Here at the Open Door Mission, we offer Coffee with Candace on all of our social media platforms, and actually have over 1,000 viewers. And we try to keep it to less than 20 minutes. We share an update, of course, because people want to know what's going on, but we also share ways for people to be engaged and empower them to continue to make an impact at however they can do that. Another way that we reached out to our volunteers was to create Friends of the Mission. And so once a month, we offer a Zoom link. So it is exclusive. It's not on our social media platforms. And we embrace our volunteers, and we're trying to engage with them and win them back. And as I mentioned in my presentation, our volunteer in place, I encourage all organizations to really strategically look at how they can empower people to make an impact from the comfort of their home, from their workplace, and how, because we can't do it alone. We absolutely cannot do it. And so for us, it was creating opportunities that were meaningful, not only for the volunteer, but for us here at the mission. We get hundreds of sunshine jars that we get are filled with little candies and inspirational words. And everyone that enters our door experiencing homelessness during intake gets one of theirs for their own. to keep. And so just, I really encourage to really get creative with your team on how you can brainstorm to meet the needs. Because I don't think, even though we're coming hopefully to an end of the pandemic and it's changing things, it's not going to change some of the ways that we continue to serve. And I think that that's going to really force us to be a lot more creative in communicating in all of those different channels that are very diversified.
Thank you, Candace.
Okay, well,
I would
thanks,
just
everyone.
second that too.
Oh, go ahead.
Oh, sorry.
That's right. Go ahead.
No, I was just going to say, I think that the challenge has really been that creativity piece, right? Candace, like you mentioned, like because there are so many channels, like staying in touch with our donors, you know, they wanted the news, even though they couldn't be on site to help, or maybe they couldn't do, you know, canned goods were hard to find for a period of time, or meat or whatever it was. They couldn't do their normal donation. And so trying to really keep them engaged and providing them other opportunities has been huge. And so, yeah, like Amazon wish lists or like other ways that they could like easily digitally engage with us has been a challenge. And that's something that I am kind of excited about for the future, because I think there's new and exciting ways that we can keep engagement going.
Very good. I was just thinking it'd be kind of fun to just listen to all of you talk to each other about what you've learned and learn from each other. Some of that happened yesterday when we practiced. So it's good to see that natural camaraderie happen. So I mentioned earlier, we had a couple more polls to do. So Susan, why don't we go ahead and launch those? Get those up on the screen. Here we go. So will you have a social distancing mask protocol for your agency after the health directives have expired? I'll let people take some time to answer that. Looks like we're kind of about split. 45, 55. 45 yes, 55 no. Okay, thank you. And then we have one final one that we would like to find out, and this one's multiple choice. So will there be another pandemic? And if so, are you prepared? This one might take a little longer for some people to answer, but that is really an important question. And Candace just touched on that, is how things have changed, what our services are going to look like in the future. It's amazing the resiliency that we have all found, which leads to a question I was going to ask you after we're done here. Okay, it looks like so 57% said we will follow the local, state, federal mandates as they are created. Well, and hopefully, like we said, agencies are prepared now, more prepared, because we had to learn. Okay, thanks, Susan. So one of the things I thought I'd ask, and I'm sure it might be hard on the spot to think of one or two, but what kind of strength or perseverance did you see from your residents? Did you see residents helping each other out? Were there certain stories that you remember of someone who was living there, that how they touched you, or you know, how you saw them through the process? I'm sure there's probably some sad stories, and I guess I'm looking at more success stories, or if that, I saw a lot of heads nod, so feel free to share.
One thing that I was very impressed with overall with our men's and family and women's shelter was the lack of panic by the people staying here about COVID, because it could be really intimidating. I'm in a shelter with 100 other people. I'm going to get COVID. I'm going to end up in the hospital, or I'm going to even potentially die. And the people here have been wonderful about not panicking. And if someone did test positive or thought they had COVID, being very supportive of them and not shunning them. And that was, to me, that was very heartwarming, is to see the support people have had for each other, and the prayers and things that they've given to other guests, to staff, and just making it a lot better than it could have been, because it would have been really easy for there to be a lot of panic on what was going to go on, but people did a wonderful job of not panicking.
Thank you.
I agree. And I think
interesting.
that, sorry, Candace. I think the other piece of it that similarly, Amy, we were really impressed. I think our staff felt a lot more of that pressure than the residents did. It was very interesting. But I also think that as we were changing policies and we had to adhere to new ones, sometimes that can be really hard for people that have experienced trauma, especially in homelessness. Changes in policies are not easy. And so for us, as we started to implement, and as you guys know, even just being citizens in the state of Nebraska or United States, things were changing constantly new updates, CDC updates. And so, communicating with clients and residents and having them be flexible in that, I was so impressed by that. And I know, especially for those who, homelessness itself being a trauma, but other traumas and other changes, as those things came to be true, what we saw was them embracing it and then taking ownership of it. So saying, hey, now we have to do these temperature checks. Okay, well, can I volunteer? I can take temperatures. Like, let me help out and do that. Or, other pieces of like taking meals up to people who were in quarantine, or volunteering to do that. Not that we would necessarily allow them to, but volunteering and being willing to do that and being willing to go with the flow was really impressive. And then I also, the thing that Amy said, that's absolutely the thing that stuck out to me is that there wasn't any stigmatization of people. Like no one was being, you said, shunned or shut out. Everyone was just kind of everyone's had a very like we're all in this together attitude, and it's been really refreshing.
I would ditto my colleagues. And one thing that was very special for us here at the mission during that 90 days of shelter in place with hundreds of people, we were not able to maintain our recovery program for our students in a way that we would consider quality care. And those students rose to the top. They were an extension of our staff in so many ways, especially in our hospitality department and in the cleaning and the sanitation area. And the one thing that really, even after being here 26 years, our children come and go off of our property, but when you have them 24/7 for 90 days, the honeymoon period's over, people, and the behavior comes to the top. And I believe through that, we've been able to see some ways that we can actually address trauma more effectively than we ever have before going into the future. And for that, I'm very grateful.
Great, thank you very much. It looks like we do have a question that is related to the guidelines that you might have in your shelters. What are some of the guidelines that have to be followed to utilize your resources? So I guess someone's looking at how do we refer people, or how do we access your resources?
Sure. Well, at the Open Door Mission, as I mentioned, we have 40 programs that we offer for free. So I'm going to stick to a couple that are truly basic. And if you want to know more, you can visit theopendoormission.org and click on About Us. And we actually have a printable document on many of our programs and who to contact and how to find out more information. But when it comes to emergency shelter here at the Open Door Mission, you just have to be in need. So you just walk in and you're going to complete the intake, as I mentioned, as far as the CDC questions and protocols. In emergency services, we have resource case management. And a couple of our main guidelines in the emergency service department is that you can't be, as far as violence, we have a zero tolerance policy for violence for yourself or others. And pretty much everything else we can work with. We've gotten creative when we have people that come in under the influence and they're not a danger to themselves and can sleep it off. Then we have a fabulous morning meeting called Donuts with the Director. And that's more or less a come to Jesus moment, because we're not going to enable you to continue to stay here and actively use, because we have a recovery program. And then in our life-changing programs, we have a Veterans Housing First, a Journey to Work, as well as a New Life Recovery Program. And we have an application process for that. As I mentioned, for our outreach programs, although we say once every 30 days, there's exceptions to the rules. There's a lot of gray. Many of our individuals and families are living on fixed incomes. They're living in poverty, marginalized, and they truly have crisis. Their car breaks down, an appliance, they have slumlord that won't fix something. And so there is exceptions where a family or an individual may have to come more frequently than once every 30 days. We are not open to the public in our community dining room prior to COVID, you could come in and use our day facilities for accessing the internet at our learning center or our day room, or having a shower. You could actually go into our dining room and eat a hot meal. And we currently still are just offering meals at the door if you do not want to enter our facility due to safety. Now, we are looking at all of our protocols and our practices when it comes to the mask mandate and how that will affect visitors and on our campus and all of the day facility programs. We just have not made those decisions yet, John. I hope that answers maybe a question that someone might have had about the Open Door Mission. And my email is cgregory@opendoormission.org, and I can obviously answer questions on a more personal level if you email me.
Thank you. Liz or Amy, do you want to talk about some of your guidelines?
You know, for us, similarly, emergency shelter, you just need to be a needed shelter. We're open 365, 7 p.m. daily. You know, as far as, I'll speak specifically to COVID. So for us, when you come in, if you haven't, we do require testing or quarantine. So we let people choose. So they can either go ahead and sign up to get tested at the health department, or they can choose to go into a quarantine time period. And for now, we've edited that over time. Right now, it's 3 days just to monitor symptoms and keep an eye on things. And then we, will continue to have a mask requirement. We don't foresee that ending anytime soon. And we're kind of really working with the health department to make sure that that's implemented. And that's, I'm in Grand Island. And so our city measures have been a little bit different here too. So for us, that's kind of the requirement. You have to be able to wear a mask, and you have to either be willing to quarantine or isolate, or go, do testing. And then, there's been a lot of fear, I think, that we've seen from clients about whether we will require vaccinations. And at this time, we don't plan to do that. But we would definitely encourage people, of course, to do so. And we have a van that takes people twice a week to do that. And that's something that we will continue to encourage as those are available.
With like Candace and Liz, our emergency shelter is open 24/7, all day, all year round. We do, again, require a negative COVID test or about a 3-day quarantine. Most people do choose to get tested, and I think that's kind of a peace of mind for them as well. We require masks in any commons area. About the only time you can't wear your mask is if you're in your own sleeping area, then you do not have to wear a mask. We take temperatures upon admissions for anybody, whether they're a volunteer coming here for a meeting or coming here to stay. And then we do, like I said, that the temperatures 3 times a day with the people staying here. We did open up our dining room again for people to walk in to eat. They have to wear a mask, and they do get their temperature taken as well. If people don't want to do that, they're more than welcome to take a to-go box so that they can still have something to eat. And we also run our shuttle if somebody needs to test and doesn't have a way to get tested, or needs to maybe go get a vaccination. We also have our shuttle so that we can do that. So we want to be able to continue providing services for the people that need it, but continuing to protect the people here and the staff and the volunteers.
Okay, thank you very much. Yes.
I'm getting some questions about the names of our bipolar ionization units and that we put on our HVAC. And I apologize, I'm not the right person to ask that, but I can get that for you if you email me. I do know, in answer to the question about the safety kit, that's an Ensure Touch Luminator meter. And I can also send that to you if you email me. And yes, it does test for your germ level on the area that you're testing. We primarily do our door handles, anything that we try to do touchless as much as possible. But again, we do those testing periodically throughout the campus because we want to make sure that we're following protocols and procedures to keep everyone safe. But if you email me, I can give you the link to those and the foggers where we bought those and the names of the brands.
Very good. Thank you. Yeah, and if you wanted to, Candace, you could email that to Susan or I, and then we could just send it to everybody who attended. Yeah. Okay, very good. Well, and everyone heard about, we also talked about homeless prevention and rental assistance. And so I just wanted to remind everyone that the state of Nebraska does have emergency rental assistance across the state. There are different jurisdictions that are managing the funding. So I think I'll just direct everyone to coronavirus.nebraska.gov, because if you go on there, it'll have all the different jurisdictions for Lincoln, Lancaster County, for Omaha, for Douglas County, and for the tribal affiliations as well. So that's there was $200 million of rental assistance to keep people housed for tenants and landlords. So want to make sure and access those dollars. All right, well, since I don't see any other questions, let me look. Okay, I see Susan put some. So I'll go ahead and do my outro here. So that completes all the questions from today's presentation. I would like to thank everyone for attending, and a special thank you to our presenters today. Thank you again to our sponsor, Midwest Housing Equity Group. This webinar has been approved for 1.5 hours of continuing legal education and mental health continuing education. If you neglected to enter your license number when you registered, you can contact us after the webinar at outreach@NYFA.org. This webinar and previous webinars are recorded and available on our website, NYFA.org, under Community Development, Trainings and Webinars, or you can go to our YouTube channel, which is NYFA Housing. Stay tuned for our next stay tuned for our next Wednesday webinar in 2 weeks, May 19th, on the impact of substance abuse on long-term housing for low-income and at-risk individuals. We are moving to a bi-weekly Wednesday webinar. We've made that decision. So thank you very much to everyone who participated and our panelists, and I hope everyone enjoys the rest of your day. Thank you.